I'm at the Performing Arts Center today to see a unique play designed by McMaster University medical students. It highlights common barriers to accessing healthcare for the most marginalized citizens of the Niagara region.
Are you Nick Stanley?
No, I'm Neil Sanders.
Whoops.
I just thought it would be something fascinating to try and do here is to use theater and health research to affect policy change, potentially. But I think what this does is it both has an educational component for medical students and has the possibility of actually getting entire communities, whether it's students or professionals or the patients themselves, involved in trying to tackle these problems. So I think that goes a step beyond just the educational curriculum and really into, I guess, social activism backed up with research and medical education.
Neil Sanders is a homeless man, struggling with mental health issues and being bounced around the healthcare system. As the play unfolds, the audience intervenes where they see the system failing Neil and offer potential solutions. I'm here with one of the audience members who actually got involved in the performance this afternoon. What motivated you to want to say stop and get involved?
What motivated me was when I saw the way the physician was behaving towards the patient. I found it offensive and irritating. I thought if someone had treated me that way, I'd be quite upset. So I had to stop the actor and behave the way I thought he should.
And what is your reaction to the performance in general this afternoon?
It's amazing. It's very thought-provoking. It's very sad. It's very real. And I am pleased to be a part of it because I feel like hopefully there's room to educate and change.
There are immense issues, structural issues, in the way that we manage the medically disadvantaged, many of whom are homeless, who don't have access to primary care, to a family doctor, who are relying on resources that really are not appropriate to manage the complexity of the problems they have, such as walk-in clinics or the emergency room. And terrific discussion about what that means and ideas how that might change.
It's a hard world being homeless. It's scary being homeless.
The students interviewed 16 community members and collected 270 pages of material. This was turned over to Branch Out Theatre to create the script.
You can read a lot of research about the effects of depression on homelessness, et cetera, and most of us don't take the time to read that research. And so having theater where we can actually understand the implications and furthermore seeing it, right? Seeing somebody go through that process, seeing somebody ask for help and not get it and not get it and not get it, it allows us to connect, I think, with the information in a way that unless you have that personal experience, I don't know there's another way to connect with it.
This is a research project, which means we come in with a hypothesis, but we don't know what we're going to get. But if there's any kind of benefit at all, whether it's healthcare providers got to learn more about their patients, or patients got to feel like they were making a difference, or panelists from these different sectors found that this was worthwhile and will be using the research to inform their decision making, anything along that spectrum to me means that the research has worked. It produced a benefit regarding these issues, and it may lead to change. Maybe not today, maybe not next year, but it's starting to put those ideas out there.
Near the end of the play, one character states, "It's a vicious cycle, but something has to change." Thank you to these McMaster students for engaging the community and creating a forum for this important conversation to take place. Reporting for The Source, I'm Marty Mako.